15-year-old Jennifer Brown has presented to the emergency department with altered mental status. The patient is accompanied by her mother, who expresses concern with her daughter's increasingly bizarre behavior. Patient's mother says her daughter has not slept in several days, refusing to eat, and is constantly distracted with her phone. The patient has no psychiatric history, but the patient's maternal grandmother was diagnosed at age 18.
Hello, my name is Erin, and I'm your nurse today. Can you tell me your name and date of birth, please? And do you have any allergies?
No, I don't. Hi, I'm Drake's wife.
No ma'am, she is not. This is my daughter, her name is Jennifer Brown, okay? I brought her in today, but her birthday is 5/8/2007, and she has no allergies.
Okay. So what is bringing you both here today?
Well, my daughter has not been eating, drinking, or sleeping. I think she must have hit her head because she has this idea that she is some type of world's dance influencer or something. She's trying to make these TikToks, and she's been doing the TikTok moves and dancing out in the street, and it's very dangerous. I don't know what's going on because all the money she saved to buy her a car, she decided to go out and spend on Beanie Babies and dog food for the Beanie Babies, okay? She has this thought in her mind that they're gonna be singing in the background when she makes her TikTok video, and she thinks she's Drake's wife, so that's why she keeps saying that. But she swears that the last post he made is about her. This is why she looks like this.
No, you're not running me like a refrigerator. You want my spot? Well, you can't have it. I'm Drake's wife, and he's gonna have Twitter cancel you. I'm gonna leave you a poll. Call Fitz.
Ms. Brown appears to be displaying behavior seen during manic episodes of bipolar 1. Risk factors for bipolar 1 are complex, but include a combination of environmental, genetic, and neurodevelopmental factors. Based on Mrs. Brown's family history, this increases the risk of developing the disorder. Signs and symptoms of acute manic disorder include feelings of euphoria, impulsiveness, increased irritability, high-risk behavior, increased energy, rapid speech, grandiose ideas, decreased sleep, decreased appetite, disorganized thoughts, inflated self-esteem, delusions, and hallucinations. In order for the patient to meet diagnostic criteria for this diagnosis, the symptoms must be present for at least 1 week or nearly every day.
How often has she been acting like this? And is this normal behavior?
It's been about 3 or 4 days since she's had more than an hour of sleep. But this irrational behavior, it started about 2 weeks ago. She's usually very quiet and responsible. I mean, she works at Chick-fil-A on the weekends and she attends church. She gets good grades. Even worse, she's been doing and saying weird things like when Sister Harris told us that she had cancer and asked the church to pray for her, she was laughing. And worse, she made like very inappropriate and sexual comments to the pastor.
I did not. I said I was showing something that night, but you would have let me out the house.
There's just so much going on right now. So, I mean, I know the finals are coming up. She's going to the prom, and she's even been applying to colleges early, but I'm afraid this behavior is going to hurt her in her future. I need to find out what's going on with her.
As mentioned earlier, symptoms of bipolar 1 disorder include high-risk behavior. This includes drug use, alcohol misuse, and sexual promiscuity. Also, if the patient continues with physical activity without food, water, or rest, this could lead to exhaustion and death. At this time, the priority is to focus on physiological stability or self-care, while also maintaining safety. Myelotherapy has proven to be useful when de-escalating patients in acute exacerbations of certain psychological disorders. Myelotherapy provides a less stimulating environment that includes solitary and non-competitive activities like coloring or writing. Staff will also be present at all times to observe the patient's behavior.
Okay, first let's get some background information on your medical, surgical, and family history.
Okay.
Is there any alcohol or recreational drug use?
I don't do drugs. Why would you say that?
calm down. Let me answer that for you. I mean, there's not much to tell. I mean, she was a premature baby, but I mean, besides that, she's fine. No diseases, and the only surgery she ever had was like oral surgery. And I mean, as far as her dad and my side of the family, I mean, you know, high blood pressure, maybe some cholesterol for my uncles and stuff. Aunt Mabel, she has sugar, but everybody else is fine. I mean, except Grandma Bessie. I mean, there was this one time where she painted the walls with pig's blood because she thought it was gonna protect us from anthrax, but I mean, Grandpa Joe handled that, and the church prayed for her, and she seemed to be fine, but that was just an isolated incident.
So the next thing I'm going to do is I'm going to get a set of vital signs, a urine sample, some blood work for a complete blood count, and complete metabolic panel, so that way we make sure that you don't have any infection. We also want to check your fluid and electrolytes to make sure that you are not dehydrated, because you've been very active. Once we get your results, we can go to the next step.
Okay.
I don't like this color.
Jennifer, would you please let her do your vitals so we can find out what's going on?
I don't like this.
Can I put this on again?
Yeah.
Thank you so much.
This will be real quick. Just gotta take your temperature.
So your heart rate is a little high, but that's normal because you've been pacing around, but all your other vitals are within normal limits, okay?
Right.
A full physical exam and comprehensive psychiatric assessment should be completed. In addition to these assessment tools, a CBC, CMP, UA, and urine toxicology screen should be done. The purpose of these tests is to rule out other possible underlying causes for the patient's behavior.
So I do have some test results for you.
Okay.
Based on the information we have gathered, the results from the specimens and the blood work, the doctor has determined that your daughter suffers from bipolar 1 disorder. We are going to admit her because she is severely dehydrated and she has a urinary tract infection. We will hook her up to some fluids and try to have her pee every 2 to 3 hours to flush out that infection, and hooking her up to some fluids will also help with the dehydration. We will also need to give her an antibiotic.
She has bipolar. Are y'all sure? I think that's what Grandma Bessie has. I can't go through this again. Why is this happening?
The Beanie Babies told me the UFOs are coming on Earth and everybody's gonna die. Nurse Ann, can I put something to your hair? Cause I gotta do the TikTok and I can't have you up there looking like that. Do you think you can fit into this?
Based on DSM-5 criteria, Ms. Brown was formally diagnosed with bipolar 1 disorder. During an acute episode, the focus is on physiological stability or self-care, while also maintaining safety. This is phase 1. Due to the patient's possible self-destructive behavior, phase 1 should be implemented in a hospital setting. Phases 2 and 3 will focus on medication adherence and preventing relapse. An individualized relapse prevention plan will be implemented at this time. Communication strategies will also be implemented in an effort to provide the most effective care.
I understand that you are concerned about your daughter. There is a strong genetic component associated with bipolar 1 disorder. Miss Brown, are you seeing UFOs?
You don't see them? There's one right there. Or right there. Everyone is going to die.
Miss Brown, I don't see any UFOs.
Okay. That's on you.
Relapse of bipolar mania is possible, but the likelihood of relapse decreases with consistent medication adherence. In phase 2 and 3, a medication regimen should be established. There are several classes of medication that can treat bipolar disorder, but mood stabilizers are generally the first line of treatment. These classes of medications can be combined if the patient is treatment resistant. Although the patient may experience a depressive episode at some point, antidepressants should be avoided or used with extreme caution, as they may trigger a manic episode. In addition to medication adherence, self-care for bipolar patients is essential. Lack of sleep can also trigger manic episode relapse. Acute manic episodes can be devastating to the patient and family. Psychological care interventions should be provided to the patient and family.
So the doctor has prescribed you some fluids and antibiotics.
So is she just gonna stay here and get these fluids?
We will be admitting her to the hospital
Okay, why are we doing that?
to monitor her mental status,
Okay. And then what happens?
and then we will be putting her on the psych unit.
And what's gonna happen there?
Right there, she will be involved in Milo therapy, and this will help her get on a medication regimen because the environment will decrease the stimuli since she is hyperactive.
Oh, okay. I mean, do you think all this is necessary? I don't know if she's wanting attention, but we're talking about a stay in the hospital. Like, how long is this gonna happen?
I understand this can seem overwhelming. We do want to closely monitor her until her labs come back normal.
Okay.
The reasons we do want to have her in a psych unit as she is at risk for injury due to her manic episode.
Okay, well, thank you so much, Nurse Erin.
You're very welcome.
Since being admitted, the patient has been transferred to inpatient psych for the last 3 weeks. Today, the nurse will discuss care for the patient since she is a minor.
Come
Hi,
in.
Nurse Erin.
Hey, Miss Brown.
Mind if I sit?
Yes, have a seat. Thank you for coming in today.
No problem.
I wanted to talk one-on-one with you about your daughter since it's important to keep the family involved since she is a minor.
Yeah. I mean, it's a little exhausting, but I know it's important, for us to care for my daughter.
Exactly. As you know, the week when she was admitted, she did have a depressive episode for about 2 weeks.
Mhm. Right. I know it's gonna take it's gonna take me a moment to get used to identifying the signs and the symptoms of when she's having a manic disorder. Kind of like, when she has those thoughts that she's like this super important person, like the queen, all the, nonstop running around she's doing, the hallucinations, and even like when she is spending her money on things that she really shouldn't be spending on. But I think that I'll really be most helpful with helping her identifying the stressful situations, because me and the other nurse was talking about it, and that seems to be like a trigger for her mania. However, what I do want to do is identify like the signs and symptoms of when she's having depression. So I remember the nurse also telling me that, some of the symptoms kind of overlap with the manic symptoms. So, you know, like when she's not really eating and she's not really sleeping, that could be part of the depression versus the mania, but it's just key to keep up with those things.
You're absolutely right. And that's why it's so important for her to take her medications as prescribed.
Yes. I know that Jennifer told me that the lorazepam was supposed to help her with her depressions, and that she shouldn't stop taking it like abruptly. But are there any side effects that I should be watching out for as far as this medication is concerned?
Yes, you do need to call the doctor if she's experiencing vision changes, mood changes, or confusion. She will be drowsy. She may be drowsy, but call the doctor if she's experiencing severe drowsiness.
Okay, so, but like, what am I supposed to do if she's like, you know, having this drowsiness? Because, you know, she's a high school kid with a lot going on and she has a busy schedule, so she needs to be alert.
That's a great question. If you notice that she's drowsy, sleepy, or she's zoning out, she could take the lorazepam at night. Actually, that would be a great idea
Okay.
because it would allow her to sleep and it would allow her to function in the morning without being too tired.
Okay. Yeah, because that's really what I want to happen. I want her to have some sort of normal type lifestyle, and I don't really want this to affect her. But I was also wondering, are there any tests that can be done to see when this whole like bipolar thing will go away and she could just be rid of it all?
Bipolar is a disease that she will have for the rest of her life, so it is important to manage her symptoms. I have printed out a packet about the lorazepam,
Okay.
and this will be useful for at home. It has signs and symptoms, and I've highlighted some key parts, so
Okay.
this will be really helpful reference. Okay.
Thank you so much for all of this.
Now that you're here with me, though, I did want to go over the mood disorder questionnaire that we did while she was on the psych unit.
Okay.
Okay, and I just wanted to see if she answered appropriately, so I want to confirm with you. These are the answers that she's answered yes to,
Okay.
which has been question 1 stated, has there ever been a period of time when you were not your usual self and she did feel more self-confident than usual. She got less sleep and
Yep.
she didn't really miss it.
Right.
She was more talkative and she spoke a lot faster than usual. She was easily distracted by things, as when she came she was opening cabinets and pulling
Things out of
the
her
bed.
bag. Yeah.
Yeah. And she did have a lot of energy with her pacing.
Yeah.
She did things that other people might have thought were excessive, foolish, or risky. And she said yes, that her money spending has gotten her into trouble.
Well, definitely, because, you know, I'm going to be taking on a new job, and that was her way to, like, get to work and her after school activities, and, like, you know, she has to do all these things to graduate, like, what do they call it when you have to go out and do stuff pro bono just to help? Whatever that is, I can't forget. But, yeah, but I agree, all the things that she said yes to, I would definitely say yes also.
So even though this questionnaire is not a diagnostic tool, it is still a helpful screening device for assessment purposes. Because she answered yes to 7 of the questions in question 1, this would be considered a positive screening result for bipolar disorder.
Okay. All right, I understand.
1 week later, the nurse and the patient's mother will meet in the common area on the psych unit to discuss discharge planning.
Hello. It is so nice to
see you both. How are you doing?
I've been so thirsty, and I've been getting a lot of acne. I don't know, and I've gained 7 pounds and promised 3 weeks away. If I get off this medicine, I promise I'll be good. But it's
So should we keep her on this med? I mean, if she's doing better, is there even a reason to make her continue taking them?
The nurse and/or psychiatrist should educate the patient and family members about medication adherence. As mentioned earlier, medication adherence is necessary to decrease the likelihood of relapse.
So the doctor has ordered you to continue taking your lithium at home for your diagnosis, and it's important to still take the medication even if you're feeling better. Your lithium level must be between 0.6 to 1.0 to be within the therapeutic range. So we do want to monitor that periodically, as a high level of lithium can be toxic. It is also very important to make sure to keep up with all your appointments with your healthcare provider.
so if I keep taking this medicine, my acne will keep getting worse and I'll keep gaining weight. What else would come?
I know you were unhappy with the side effects that you are experiencing. However, I do have some information about diet and exercise, and that will help you maintain a healthy weight. It is also important to keep up with your salt intake, as lithium can lead to kidney complications. Getting exercise such as walking for 30 minutes to an hour every day will be helpful for maintaining your weight. And it is also very important to stay hydrated. Okay? In this discharge paperwork, there is an appointment scheduled for you with the dermatologist to help you with your acne, as well as an appointment with your therapist. I've also provided information about family-focused education therapy, and I've highlighted some important points. Okay?
Okay, I like going for walks, so I can go for walks and I can bring my water bottle with me. And hey, I like to go swimming too, so I can do that 3 times a week. But what happens if the medicine stops working? I'll look ridiculous in those TikTok posts.
Over the past few weeks, we've taught you the signs and symptoms of a manic episode. The key is to catch it early. If you maintain your medication, attend your appointments, and apply all the teaching that we've taught you, you should be okay. Your labs and levels look normal, so I do think you'll be okay. Also, be sure to attend your therapy.
I like therapy, so that wouldn't be a problem.
Thank you so much, Nurse Erin. We'll do this together.
With proper medication and education, bipolar 1 disorder can be managed. Just look at me. I'm bipolar 2.